In other health news, infants and children are often subject to eye problems, and because they can't often tell us when they have problems, parents need to be aware of what to look out for. So what exactly are some common eye problems that do affect children? Dr. Brent Reed from Griffin and Reed Eyecare joins us this afternoon. Doctor, nice to have you here. We're talking about pediatric ophthalmology, and how common is it for an infant to have an eye with a blocked tear drain?
That's a good question. Well, that's one of the most common things we see in infants and children that have eye problems. About 1 in 10 children that are born will have a blocked tear drain, and traditionally or typically that resolves on its own, although it's a real concern to moms and dads when that eye matters up and tears, because it not only tears but it gets mattery and they worry about infection.
Well, how can you treat something like that?
Well, we usually observe it. We teach mom to milk the tear drain back so that the infection doesn't predominate in that area. Sometimes use antibiotic drops, but usually those drains, what happens is the drainage port on the other end of the drain pipe, so to speak, is blocked by a congenital anomaly that resolves itself by the time most of those little ones are a year old. So we usually watch them, and if it hasn't resolved by the time they're a year, we actually do a little probing of the tear drain and can open it up ourselves.
Would the first treatment, though, be when you see matter? Would it be cold or hot?
Usually it's either a compress. It doesn't matter what it is, cold or warm, but it's usually just a little milking back and then cleaning it gently out with a wet Q-tip. But most moms take the infant in to see the pediatrician right away because they're worried about pink eye or an eye infection.
You've also discussed before about children with crossed eyes. What do you do about that? Will they grow out of that?
You know, that's a real common misconception. I was taught that in medical school, that most children with crossed eyes will grow out of that, and a lot of doctors today still believe that. Unfortunately, or I should say fortunately, we're educating pediatricians better, and the American Academy of Ophthalmology now has a program to work with our pediatric colleagues to help them to understand that very few children, in fact, grow out of a crossed eye. In fact, it usually leads to some significant loss of vision due to lazy eye or amblyopia. And so we've done as much as we can to try to educate them and get them to do exams sooner on children who appear to have a crossed eye.
Now, what about adults with the crossed eyes? Would you see sometimes an eye patch? Does that help?
With an adult, it doesn't. The visual pathways tend to develop in human beings up to the time you're about 8 or 9. The brain is continuing to develop those pathways. After about the age of 8 or 9, patching really does no good, and so children need to be caught early and treated fairly aggressively. And actually, there's an alternative to patching now. There's a new form of eye drop therapy that's being used now instead of a patch. It's hard to keep a patch on a child. They do not want to wear those patches. And the eye drops seem to be almost as effective as the patch is, but it really does no good to patch an adult.
Doctor, quickly, how often should a child be examined?
Well, if they have a family history for a crossed eye, the Academy recommends that they be examined by the time they're 3 years old, or if there's any evidence of any problem with the color of their pupil, if they have a white pupil, or if they have a problem. And we actually have a way that we can examine children. We have a sheet here that demonstrates some of the figures we use that we teach them to recognize, and then they can see that on an eye chart, and we can actually tell as soon as a child's verbal how well they see.
Doctor, we thank you very much for joining us. Brent Reed from Griffin and Reed Eyecare.